Approximately 50,000 people will die from it this year alone. Colorectal cancer is the third leading cause of cancer in males and the fourth cause of cancer in females, with more than 150,000 new cases diagnosed each year.
Colon cancer is a process where the inner lining of the colon undergoes a series of changes, and the first abnormality that is seen is a polyp, which is a little bit like a wart or a raised area inside the colon. In many people, these polyps can go on and become true invasive cancers.
Although anyone can get colon cancer, the risk factors are particularly high for certain individuals. Age, diet, and lifestyle all play a role in preventing the disease.
Perhaps the single biggest risk factor for colon cancer is family history. Depending on the syndrome present in your family, some families are associated with almost 100% risk of colon cancer, whereas others have a very slightly increased risk of colon cancer. Outside of family history, age is a factor. As one becomes older, your risk is increased. Also, there are dietary factors, perhaps red meat, perhaps the amount of vegetables that one takes, and these are undergoing further research.
Because colon cancer has few, if any, symptoms, routine screenings are critically important. A colonoscopy can almost always detect the disease in its earliest and most curable stages.
Colonoscopies are recommended for patients over 50. We have increasing evidence that age increases risk, and performing colonoscopies after age 50 reduces your risk. And colonoscopy is the best test we currently have because it allows us first find any abnormalities like polyps, and second, remove those polyps, thereby reducing the risk of cancer for that patient.
If a diagnosis is made, however, the road to treatment begins. Although each case is unique, conventional treatment involves open surgery to remove the cancerous tissue. Because it requires a large incision, it can often result in substantial blood loss, a lengthy hospital stay, and uncomfortable recovery. Performing colorectal surgery laparoscopically is a minimally invasive approach that is offering a new option and new hope to patients with colorectal cancer.
Laparoscopic surgery on the colon and rectum is performed really in the same way as open surgery because we can do exactly the same operation. The major difference is that instead of using an incision 6, 12 or more inches in length, we use a series of tiny incisions less than 1/4 of an inch and put in long, narrow instruments to mobilize the section of intestine that we're removing. We can then free up the intestine, divide any blood vessels supplying the intestine, and remove it through an incision 1.5 or 2 inches in length instead of a much longer incision.
Led by world-renowned laparoscopic colorectal surgeon Dr. Delaney, University Hospital's Case Medical Center in Cleveland is redefining what it means to be treated for colon cancer. Its expertise has helped countless patients achieve faster recoveries and fewer post-operative complications.
There have been a large number of studies done showing that laparoscopy for cancer of the colon and rectum gives exactly the same cancer outcomes and survival as open surgery. In fact, at least as good as open surgery. The real benefit for patients is in the short-term outcomes. Patients spend less time in hospital, they get back to work more quickly, they've less pain, they've less scarring, and they've fewer complications.
I decided to undergo my surgery laparoscopically after talking to Dr. Delaney and my family because I didn't want a big scar, I wanted smaller ones, and because the healing time was faster.
Having trained many surgeons in laparoscopic techniques, Dr. Delaney performs about 90% of his colorectal surgeries laparoscopically, far exceeding the national average of just 15%.
I'm a great believer in laparoscopic surgery for the colon and rectum because of the outcomes I've seen with this technique. I was trained by experienced surgeons in the process, and I've had the great fortune to be able to do this type of surgery for a large number of patients. And in seeing this surgery done for so many patients, it's become very clear that the recovery is dramatically different to the recovery seen after open surgery. We can do exactly the same operation with exactly the same endpoints of cancer cure and things like that, but we're giving the patients much smaller wounds, much less pain, and so they can recover from their surgery more quickly, getting back to normal activity in society.
My recovery went well. After a few days in the hospital, I went home, and then after about 2 weeks, I was back to my normal schedule and going to church, hanging out with my friends, and after about 3 weeks, I was back at work.
Laparoscopic surgery can actually be used for almost any condition of the colon or rectum.
It can also be used for benign conditions of the colon or rectum, such as diverticulitis, Crohn's disease, and ulcerative colitis. And again, the patients who have surgery for these conditions have the same operation done, but they recover from their surgery more quickly with fewer complications.
Because colorectal laparoscopic surgery is still so cutting edge, choosing a team well trained in the procedure is vital.
Researching the team that is going to perform your surgery is of crucial importance. If we think how much effort we put into deciding what type of car we're going to buy or what type of ball team we're going to support, we want to get all of the factors weighing in so you make the right choice. The same goes for an operation. It's perhaps one of the most important events in your life. You want to make sure that you have a surgeon who's well trained in the technique, who's experienced in doing the technique frequently, and you go to a hospital where they're experienced with this type of operation as well. There is good research now showing that surgeons who do more of a particular kind of operation in hospitals that have experience with these disease processes have better outcomes for their patients.